Morning, guys. Can you hear me? Good morning. Good morning. I think we're live. Can you hear me? Good morning. If you cannot hear, please indicate on the chat that you cannot hear so we can figure out if there's an issue. Can you hear me? Okay, I can't see those names there. Okay. 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 I'm assuming you can hear me. There was a bit of kind of noise on that end, but can the others hear?
Yes, we can hear you, Prof.
Okay, good. So good.
Good morning, Prof.
Good morning. Good morning. Welcome. How are you? How are you guys doing?
We're good, thank you, Prof.
Good. Well,
And how are you, Prof?
I'm fine, thank you. A bit exhausted, but happy to be here, and I'm glad we can eventually get the Module 5 off the ground. So before I start, what I want to do is just take a few minutes to apologize for the issue that we had. It was essentially a flight issue on my end, and I couldn't get into the country in time. And the best was to delay it a week instead of trying to get in midweek. So I really apologize for that, but it was really something out of my control. But I'm happy to be here. I apologize for the inconvenience. And I also want to apologize for bringing you in today on the 26th. I know tomorrow is a vacation, and some of you may have planned an extra long vacation. But what I want to kind of reassure you that Module 5 was generally a shorter module, and I will actually try. The principles, I think, are, although extremely important, but we should be able to get through them quite quickly. So I should get you out pretty early today, and you'll have a thorough understanding of this concept that we're calling client engagement. Okay, so you'll be done pretty early today. So if you have any plans, you can factor that in. Also, apologies from Prof. Naika and Prof. Bridgelal. They were supposed to come in to do some updates this morning, but you know, for I guess vacation-related reasons, they're unable to come and do the reviews, but they promised to come back in Module 6. As you know, we're kind of reaching the end of the program, and I hope it's, you know, it's starting to come together, but I think, you know, as we get to the end, you'll be able to piece all of these things together. So just a few words on the assignments. Remember, assignment 1 needs to be sent to me. Now, my assistants have been going through my emails. I think some of them have probably gone into junk mail, etc. But if I can just ask you to please resend all, because we haven't, it seems like we don't have all of them. Now, that could be one, there's been a system issue. 2, it's been rejected by my university email. 3, you probably haven't submitted them. So I'm asking you to please resend all assignment 1s to me. Okay, if you could do that this week, I would appreciate it. I'm back in the office on Friday, and we'll work on my assistants to retrieve that. So I really would. Assignment 2 needs to go to Prof. Bridgelal. He's received several. There are some that are outstanding. And his comment to me yesterday was that overall the execution is pretty good, but the focus seems to have been more on giving him back theory as opposed to more kind of analytics in terms of the business plan. Okay, so, and I think Prof. Naika overall, is also quite happy with that. But once again, it seems that all the assignments are not submitted. So please remember, even if you have submitted assignment 1 to me, please resubmit it. If you have not submitted it, please submit by the end of the week, okay? If you need to get hold of me in this week till Thursday, it's probably the best because I'm on real time. So, you know, I'm on South African time. I know it gets a bit difficult when I leave and, you know, become 7-8 hours behind. So that's the problem. So just to reinforce, assignment 1 needs to be resent or sent to me. Assignment 2, if you have not sent it to Prof. Bridgelal, please send it directly to him. Some of you have been sending it to me, and we've been trying to forward it to him. But remember, if it's not reaching me, it's not going to get to him. And Prof. Naika is responsible for assignment 3. Once again, further good news is that there is no assignment after module 5. So you can kind of take a bit of a break, but use the time to, I think, review, recap, and revisit your assignments 1, 2, and 3. It's critical because we're going to use it at the end of the program to provide those certificates that you're going to need. Okay, so do you have any questions about the assignments or about the modules to date and today? Any questions? Anybody has any questions? So you can ask the questions, go live, switch on your video, ask the questions. You can type it in the chat room. But are there any issues, any clarification that you need from me before we move on? Okay, if not, we'll get cracking. Just another reminder that the videos for this will be available on the electronic learning management system that we have. So it'll take you to YouTube and you'll be able to access this directly as well. So no excuses if you step out and miss parts of it, and so it's going to be available. Okay, so I generally don't use PowerPoint presentations. I tend to write mostly on the board, but for this module, I've opted to use the PowerPoints. Now I know you don't have the PowerPoints available, but I will make them available to you as soon as we're done with the program today. So you'll have access to the PowerPoints. If you want to write notes, just make some notes on each slide. So just title them slide 1, make a few notes, slide 2, and then you will get the PowerPoints. You can print them and write your notes on them. Okay, so the PowerPoints will also be available on the learning management system. And I think we should be able to send it to you via the chat room as well. Vic, can we do that? Okay, so Vic, by the way, he's the guy who manages the studio here. He will also post the PowerPoint presentation on the chat room, and you can go right there and download it as well. Okay, so let's get going. Module 5 is actually entitled Managing the Client Experience. And you know, it's kind of what you may call, although there's no soft managerial skills, I don't believe in the term, but managing the client experience can be kind of classified as a non-quantitative approach to management. And to me, I think everything else that you do in a leadership or managerial context really depends to the extent that you have an engaging relationship with your customer base, and in your case, your clients, and to those that you work with, your staff. Okay, so when we speak of client, I know I titled the module Managing the Client Experience, but you have to bear in mind you have two types of clients in the organization. Okay, One would be your external client, and these would be traditional customers, or clients, or in healthcare it would be your patients. And your internal clients are actually your colleagues. And depending on where you are in the organizational structure, these may be subordinates or people that you report to as well. So this is about client engagement. It is about managing the client experience. And it is one of the caveats in the public sector in South Africa. Irrespective of which department you represent, we for some reason place very little or no emphasis on having an engaging relationship with our clients. Okay? And you have to understand that the success of what you do in your department actually hinges on successful client engagement. The ability to give the patient, the client, an optimal experience, to give these people that are working with you the optimal experience so that they can become part of the service that you're providing or engaging actively within the organization as well. So it's absolutely critical. You bear in mind that the heart and soul of what you really do is relationship management. You are in the relationship management business. That's what you are. That's what social services is all about. And client engagement is a tool to enable you to succeed in that relationship management process. Okay? And what we've done is essentially look at highly service-oriented industries and organizations that place a lot of emphasis on client engagement and on customer engagement and management, and kind of extract from them, lessons that we can use in social services and that we can use in healthcare, and more importantly, use in the public sector generally. So what makes the hotel industry so good when it comes to customer engagement? You can argue that some of the airlines are. But, just even walking into McDonald's, you have to agree that from a customer engagement point of view, you'll have to score them pretty well. Far better than most public sector organizations that I know. So that's really an indictment on us. And the reason that that's the case is we do not regard client or customer engagement or managing the client experience as a science. And by the way, it really is. So what today is all about is looking at how you manage these two sets of stakeholders, your external or customers or clients in your case, and your internal colleagues and employees. And I'm going to give you essentially some tools so that you understand how to actually, so you will leave at the end of the day with 2 or 3 tools that if you use the way we ask you to use it, and if you're able to go back to your organizations and get everybody else to use it, then I think you should see a visible, palpable difference almost instantaneously. So that's what today is about. Okay, so Vic, if you can just put up the first slide, and we'll go through that. Okay, so I've titled this "Reaching for Excellence in the Client Experience," and I think it kind of summarizes exactly what I just described to you. And as I said, I'll give you the logic for this kind of approach. We'll give you the actual tools. A lot of this we derive from other industries as well. So I want to firstly kind of, if you can just mute, please. Please mute if you have a question, put up your hand so I can stop and you can switch on your video and ask a question. Please, that applies to all of you throughout. So whenever you have a question, irrespective, just put up your hand. Vic will let me know. We will stop. You switch on your video and you can ask the question. Okay, so this is kind of what the session is titled. We have about 3 different PowerPoint presentations for you, and I think it's pretty simple and self-explanatory because I wanted to deliberately make these tools simple so that you actually remember that. Okay, next slide. Okay, so, sorry? Go ahead. Was that a question? Hello? Was that a question? Okay.
Someone muted us.
Hey?
Someone muted us.
Okay. Have they unmuted?
You're back.
Okay, I'm back. Okay. Yeah, try not to mute me. You know, just step out of the room if my voice is irritating, but don't mute because you'll affect the whole presentation. Okay, so some of the things we have to clarify, and in my experience in South Africa, what I've noticed is people kind of conflate client satisfaction with client experience. And I noticed that, you know, a lot of, especially in the Department of Health. Now, you're going to help me with as far as social services is concerned. In the Department of Health, they've been rolling out over the years what they call patient satisfaction surveys. So I actually met with the Minister of Health not so long ago, and I put a stop to it because I said to him that measuring patient satisfaction is actually futile. And he was kind of shocked and puzzled, and I gave him the explanation that you see up here. So before we move on, does social services do client satisfaction surveys? Do you actually survey clients to assess and evaluate how satisfied are they with your services? That's a question. Do you actually do satisfaction surveys? Hey Tabile, switch on your video and let me know and talk to me. We can't hear. I need somebody to tell me if social services does client satisfaction surveys. Anybody? Hi.
Hello.
Hi, I can hear you.
Yes, we do have suggestion box, but they are not implemented effectively because we sometimes not receiving the results.
Okay.
But we do suggestion boxes.
Okay,
And
so
we do have also suggestion boxes, and the team, the
yeah.
quality assurance teams in health section, they
do have suggestion boxes.
Yes.
Yeah, suggestion boxes are not satisfaction surveys. Okay, you're just asking people for ideas. It has its place, but it is not a satisfaction survey. So if you have not conducted satisfaction surveys, you know, it's a good thing and a bad thing. The good thing is it gives us the opportunity to start afresh and come up with a survey for client experience, which is far, far superior to client satisfaction surveys. On the other hand, I think, you know, it is something that should have been done. To get a sense of are the clients, you know, satisfied with the services that they're getting? You know, what do you base your improvement on if you're not getting any feedback from your clients? So I think if you have not done anything, then it is something that's actually imperative. Okay, but as I said, the positive is we can kind of get going with a client experience survey that's far, far superior to satisfaction. Now, this is the difference. People often use them interchangeably, but there's a massive difference between satisfaction and experience. Okay, the one is satisfaction is a subjective measure. And experience is more objective. Okay, this is critical. So if you go on and you start a survey that's assessing levels of satisfaction, it's extremely subjective because the levels of satisfaction will depend on the individual circumstances who's answering it. Whereas experience is something objective. It's something that you experience. Now, one of the common examples I use to describe the difference between satisfaction and experience is this. So you see a homeless guy, poverty-stricken homeless person, and you offer them a plate of food, okay? And you ask them, after you've given them the plate of food, how satisfied were you with the meal? And you rank it from 1, I'm not satisfied at all, to 5, I'm extremely satisfied. What do you think the answer from that person is going to be? You give a homeless guy a basic meal and say, after ask him the question, how satisfied were you with the meal? What's the answer? Going to be closer to 1 or 5, where 1 is I'm totally unsatisfied, 5 I'm very satisfied. Where's the answer going to be? Probably around 5. Okay? Now you take that same plate of meal, the same plate of food that you gave the homeless person, and you give it to somebody that comes from Sandton or Houghton, or Mhlanga, one of these, expensive areas. You give them the same plate of meal and then you say, well, how satisfied would you 1 to 5? What do you think the answer is going to be? Most likely? Closer to 1, exactly. But this is the problem. But it's the same plate of food. So this is why satisfaction surveys don't help. It's because the same plate of food, the same plate of food is perceived differently by different people based on their expectations. Okay, now, the Department of Health comes and says to me, well, our satisfaction surveys show 80% of the people are satisfied with everything. Now, off the top, if 80% of people are satisfied with public sector hospitals in South Africa, you already got a problem. But they could not explain it. But the explanation was exactly what I'm giving you now. It is because it is a subjective measure. You give a bed to somebody who sleeps under a bridge and you ask him how satisfied you are, you give them a basic bunk, they're going to be very satisfied. Okay? You take a high net worth individual, you give him the bunk, you ask him how satisfied, he's going to be pissed off. Okay, so this is the problem with satisfaction. It is a subjective measure and really depends on the individual. So getting satisfaction scores does not help you from an organizational point of view to improve your service. Because, one is saying the food is great, the other one is saying the food is bad. So what do you do with the food? Because on average, if you average those two scores up, the food is kind of, well, it's okay, isn't it? If you average 5 plus 1 is 6, divided by 2 is 3, 3 is midway, and you say, well, it's okay. The service is good, okay? Now, what is experience? Okay, experience is distinctly different. It is something that you encounter, something that's objective. Did you experience it or not? So if I ask the homeless person, were you greeted before you were offered the meal? The answer is yes or no. They were either greeted or they were not. Were you explained what's in the meal? The answer is yes or no. The same thing to the wealthy guy, where you greeted, where you explained, yes or no. So from a leadership management point of view, you actually have better levels and quality of data to act on experience as opposed to satisfaction. So do you get the difference? It's extremely important that you get the difference between satisfaction and experience, because moving forward, although satisfaction is important, it really doesn't compare from a leadership managerial point of view as experience does. So when we move forward, I'm not going to be talking about client satisfaction. I want you to dispel this concept of client satisfaction as being important. To us, moving forward, from now on, for DSD, client experience and managing the client experience is what we're going to focus on. Okay? So bear that in mind. Experience is something that somebody encounters and literally experiences. Satisfaction is a subjective perception of something. So we cannot act on that. So whenever you see documents with high satisfaction scores, the value you're going to get from that is very low. Okay, so bear that in mind. It's very important to differentiate between experience and satisfaction. Any questions about these two concepts? Any questions? Are you guys comfortable with that? Hello?
Yes, thank you, Prof.
Good, good. Okay, so if you're comfortable, we'll move on. So from now on, dispel satisfaction. We're now talking about experience. So the questions are, why is experience valuable? What is experience? How can we enhance the experience of our clients, etc., etc.? Okay? So although satisfaction is important, it is not something that you can use as a manager to implement change and improve. Okay, let's move on. So I've kind of specified the learning objectives for this course. We missed that. But okay, so we've got this slide here that says the experience is foundational. Now I pulled this up from the Hippocratic Oath, and essentially, I know this doesn't apply to you, but since you're in the people and relationship business, I thought it's pretty similar. But the point here is that I will remember that there's art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knives or the chemist's drug. Okay, so what is Hippocrates saying in this little quotation? Anybody? What is it saying? What is the essence of this quote? What is the essence of this quote? Well, in the context of healthcare, what Hippocrates is saying, that the actual clinical intervention is secondary to the way you actually manage your patient. So managing the patient as a human, demonstrating warmth, empathy, sympathy, and understanding is far superior to the scientific intervention that you're going to execute on this patient. So he puts the experience, in this case the patient experience, ahead of the medical intervention. Okay? Now, if that's applicable in medicine, then it's got to apply to you as well in social services, okay? Because you've all been to university. You know, social sciences is a academic discipline. It gives you frameworks on which to intervene. But so the exact same thing will apply. That those interventions, those scientific interventions that you kind of implement in your practice are superseded by the way you manage that patient experience or that client experience. Okay, so, and this is not something, everything you learn today will not be something that you would have learned at school or university, which is kind of the real crazy thing for us in medicine and social services and for all of us in this relationship business. It's pretty crazy that they don't teach us these things, and we have to wait till now, although, as you can see here, they say that, you know, the medical intervention is secondary to actually managing the patient experience. So bear that in mind. In the relationship business, this ability to optimize the relationship between the client and yourself is actually more important than the intervention that you're going to execute. So you have to understand and know how to manage and optimize that patient experience. And I'll show you later on why it's extremely important. Because there's a powerful, powerful correlation between a positive client experience and outcomes. Okay, and the outcomes we can look in different shapes and forms. Okay, next slide. Okay, so this is kind of the point I was making. Caring for people takes more than the science. So in your case, it would be the social science. And as I said, emphasize again, the science is secondary to actually managing the patient, your client experience. And if that is the case, it kind of makes logical sense that we have to spend a lot of time in figuring out how to optimize that patient experience. Because if the value of that is higher than the actual intervention, then strategically it makes sense to craft the organization to do that part of it well as well. Okay, good. Next slide. Okay, so what creates an exceptional experience? I think that's the kind of key question that we have. And this is kind of what we're going to try and answer as we move along. Okay, so the key question is what creates this? What can we do to actually optimize the patient or the client experience as you move forward? Okay, next slide. Bear in mind, all of these slides is something that you will get, and they'll be made available to you. So if you take notes and correlate them to the slide number, you can print off these slides and write the notes. Now I got this little graphic, and it pertains mostly to healthcare, but when I thought about it before I actually put it in the slide deck, I said, well, it's pretty much conceptually the same thing. So if you look at, you know, suffering, and in the context of healthcare, you know, you get unavoidable and you get avoidable suffering. Okay, it's pretty much the similar in social services conceptually. As you can see in healthcare, the most suffering actually is avoidable and is due to the dysfunction in the healthcare system. Patients suffer more from their experience and engagement with the healthcare system than they do from the actual condition themselves or the treatment, which is a real indictment on, in this case, healthcare, that we have not underemphasized, but we have not placed enough emphasis historically on optimizing that experience. You know, making patients feel comfortable, empathize with them, demonstrate authenticity, build this trust, build this relationship with them, because that's actually critical You know, in your case, I think it's probably even more so because you don't have kind of a, well, in some cases you will have a clinical diagnosis. You know, can the harm be caused by some of your interventions? I guess yes. But I think the point of this is that the avoidable suffering is something that we can actually mitigate by putting in place substantive mechanisms to enhance that patient experience. Okay, in your case, the client experience. So bear this in mind. If you can adapt this graphic, I think, to social services, if some of you can just think through what would go into the green and the blue, and then it's something we can start replicating in social services as well. Okay, so you guys are the domain experts. What is the equivalent of suffering due to diagnosis? You know, this may be gender violence or whatever it is, unavoidable suffering due to treatment. You know, do you actually make suggestions that may also cause pain and suffering, etc.? Okay, but remember, the biggest contribution is something to the suffering is something that comes from us, and it's something that's affordable. So context and client experience, absolutely critical. Okay. Now, there's a lot of data around, as I said, in healthcare, and that's kind of the reason why when I posted those slides, the readings to you, I said all of the readings I'm giving you are related to healthcare, for the simple reason that I could not find client experience literature in social sciences or social services. And, you know, I think herein lies an opportunity for you. I think it's an understudied area, not just in South Africa, but globally as well. So some of you in this class, in the audience listening today, who, you know, may have aspirations of doing master's degrees or doctorate degrees, etc. This is really, really a hot and a high value topic to consider doing some studies on, because there just is no data. Okay, as you said earlier on, you don't even do client satisfaction surveys, you have a suggestion box. You know, so I have a tool for client experience that we can test out, but for you to get a better understanding, and remember, if this is more important than the actual intervention, we need to study this as well. We need to kind of craft a science and a better understanding of this in the context of social services. And by the way, I'm doing the same thing for the Department of Health because it's missing in the Department of Health as well. In the US, we spend a lot of time on patient experience. In fact, my colleague who should have been here today but is not here, you know, heads our Office of Patient Experience. We have an office and a department that's called the Office of Patient Experience Management. And all they do is ensure that manage patient issues. Okay, they are proactive in putting in place measures, etc., that will optimize the experience. They actually also resolve patient issues as they come up in real time. So, you know, if you've had a difficult time getting an appointment or you can't find a place, they don't answer your questions, but they also try and figure out, well, why couldn't you get an appointment? Is there a system failure? You know, why can't you access the clinic? Is there an access issue? So there's a massive science around that, and I think it's worthy to invest some time and energy in this as well. So if you look at this slide, this, as I said, is internal data. It's just the survey is a bit dated, it's 2010, but some interesting things here. That what patients value most is the fact that they are willing to go out of their way for a better experience. 93.8% of patients are willing to go out of their way for a better experience. Now, so kind of most of healthcare in the US is privatized, so patients can choose. But it's immaterial. You know, we cannot assume because we're in the public sector Clients have no choice, they have to come to us. That's actually a very archaic, crude kind of mentality to take in. Because the question would be, if you had a choice, would you come back to me? You know, that's one of the questions we put in the survey. So how else, if you don't test and ask clients that, would you know if you're actually meeting their standards? So we've done this in healthcare. We understand what patients want. They actually prioritize the experience far higher than the quality of the care. I mean, this is a pretty telling statistic. And you can apply that to pretty much any other industry. You know, if you go into a hotel and your experience is excellent, the people greet you, they, you know, give you directions, they tell you everything about it, they inform you, they make you feel at home, they make you feel like one, and then you go up to the room and the shower doesn't work. You're not going to be that pissed off with the hotel, because your experience is, you know, kind of...
1 second, Prof.
Okay, sorry, I think the PowerPoint's gone down, so just 1 minute. Can you hear me in the meantime, so can I talk?
No.
Okay.
Excuse me. Fucking
Hmm?
laptop.
Power.
Yeah, it died.
Okay, we back?
2 minutes.
Yeah.
Okay.
Yes, no, the first one, the client experience.
Not this one.
This one.
This one, yeah.
Are we back live?
Almost there.
Go back. Yeah. There. Okay, guys. I'm sorry we had a bit of a technical glitch, but can you hear me now? Okay, good. Yeah. So I was kind of on this slide, and as I said to you, I think it's pretty obvious what clients really want. In this case, it's actually patience, okay? But you can see a couple of telling data. One is they really want to go to an organization where the experience is good. They rank that experience higher than the quality of the service, and they're actually prepared to pay more to seek care in a highly rated institution. This is from a patient experience point of view. So the equivalent in social services would be exactly the same. You know, they will prefer you if you provide a better client experience for them. And we'll kind of drill down into that and give you some tools, etc. But this concept of client experience is pretty powerful. There's more value placed on that than on the technical quality of the care in this case. Clients are also willing to pay far more. And I was in this example of this hotel where you may have this superlative experience and forgive little issues that you may encounter in the hotel. The same thing at a restaurant. You know, if you have a fantastic experience that the waiter or waitress provided phenomenal service, you'll forgive some issues with the quality of the food. Okay? It's just the nature of us as human beings. And I think, you know, that is exactly that philosophy that we want to bring into social services and healthcare. If you place emphasis on experience and optimizing that patient experience, there are powerful benefits and powerful outcomes from that. Now in the US, you know, client experience measurements are actually mandatory. You know, it's something that I'm trying to introduce in South Africa as well. We've got to peg your performance to your client experience scores. And this notion of, you know, giving annual increases and not pegging it to any performance metrics is really, you know, also one of the big issues in the public sector. And I think once we start measuring this, we're able to differentiate between our high performers and low performers. We can actually, you know, get a sense of who within the organization is worthy of promotions, worthy of increased salaries, etc., etc. This is a tangible measure. You know, so we have tools that we can actually measure different components of that client experience. And as I say, I mean, it's not a unidimensional concept, it is a multidimensional concept, okay? That experience begins not when the client walks into your office, but even when, before they even make the decision that they need you. That's when that experience begins. So we can assess this and evaluate this. And the point I'm making is managing that experience and engagement with the client is far superior to the actual intervention that you're going to implement. This is what customers want. They put first prize on that experience. And you know, I say this over and over and over again. You're in a relationship business, but you're selling social services. You know, healthcare is in a relationship business, but they're selling care delivery. At the heart, you're in a relationship business. You need to build your capacity and strength based on the fact. Okay? If you understand that I'm in a relationship business, then you will pay attention and focus on what do we need to put in place to optimize relationships. Okay, so really important, and is essentially the reason why I put in this module, although it's kind of not hardcore management leadership, it's not finance, IT strategy, but to me is probably one of the most important modules for you. Okay, so next slide, Vic. Next slide. Okay, so this is the future. I think it's a novel concept, especially for social services, definitely in South Africa. We're trying to inculcate this concept of putting client engagement at the front and center of all public sector services, not just DSD, not just health, public services, police, etc., etc. I think it's something that's missing in our public sector services, and the reason that it's missing is we don't see the public sector as relationship businesses, okay, and that's exactly what they are. Okay, next. Okay, so do clients and consumers expect the same thing? Now, this is an old question. You know, do you actually treat your clients the same way that customers are treated by McDonald's or Starbucks or Pick and Pay or whatever it is? I mean, what do you think the answer is? What do you think the answer to this question is?
It's a no.
It's a no.
Yeah.
Okay, can you just explain that?
If you check, only then we're trying to be honest, looking at what we have just presented.
Yeah.
The way customers are treated at like the McDonald's that
Yes.
we just spoke about. It's like those who are serving customers are more persuasive.
Yes.
Persuade customers to come back. Therefore, they will treat them
Yes.
in a better way, in an excellent way, so that when they go back, they can think of coming back, or they can again sell McDonald's further to other potential customers.
Right. Right.
But with us, okay, continue, it's fine.
No, I'm waiting for you. You continue. It's interesting. Go ahead.
Okay. Then I was so I was saying with clients, with us, the attitude that I see from us as employees, you don't see that customer care that
Right.
is happening from the private or the business sectors.
Yeah.
It's like if a client comes, if you check that, even the turnaround time for assistance is faster.
Yes.
But with us, you come in the morning, officials will be greeting each other, and the client will be sitting outside
Yes.
waiting. And that does not happen in McDonald's.
Absolutely. Absolutely. I mean, you're 100% correct there. So this is exactly the question. Do clients expect the same thing? So the answer is yes. You know, clients want to be treated the way that a five-star hotel treats their guests, and by God, the way McDonald's treats their customer. Okay, so, but the difference is that those guys who operate in the hotel and those guys who serve behind the counter in McDonald's go through substantial training on how to improve that patient experience. The guys in McDonald's who fry burgers get trained in how to enhance the customer experience. But we don't. And you are the first group in DSD in South Africa to actually sit and talk about this and get some tools and kind of get some training on this. Now you can take a degree on how to enhance customer experience, but all I'm doing is giving you a kind of sense and overview of this, but you actually hit the nail on the head, okay? And I think if you go and do these customer experience or client experience surveys in your organization, I think the data will be, pretty scary. Bear in mind that satisfaction scores is not what we're after, because they're pretty objective. I'll kind of just clarify this. I said earlier on that, the Department of Health went and did satisfaction scores throughout the country, and apparently they came back, the scores were 80%. So if you look at the survey, would have been from 1 to 5, so 3 would be midway, 5 would be extremely satisfied, 1 is extremely dissatisfied. Their survey found that is this long? The survey found that 80% of patients reported scores above 3. Okay? And in fact, even the minister was shocked. How can the scores be so high? So I explained it in a very simple formula, which you're familiar with, or you will become familiar with. Value is equal to output over. Have you seen this equation before? Value is equal to output over input. Okay? So when you talk about value, you're actually talking about the relationship between the quality of your product or service over the cost. That's value. Okay? So quality over cost. Value is quality over cost. So your value is consistent. If you buy a Toyota for 200,000, you're getting a Toyota which is, you perceive as high value. You can move forward and say, well, I'm buying a Mercedes and I'm getting far more and the cost is this, but the value is the same. Because I'm paying more for something better and bigger. I'm paying less for something smaller, but the value is the same. Good value is when you get far more than good value. In this case, is if you get a Mercedes at a Toyota price. That's really good value. Bad value is if you get a Toyota at a Mercedes price. Do you get the concept of value being quality over cost? Do you get that?
Yes, Prof.
Yeah. So value is quality over cost. Okay. So quality in our case, we can refer to the experience or the satisfaction levels over cost. Now, public sector patients generally don't pay anything. Okay? So the denominator is 0. So in quality over cost, if you make the denominator 0, whenever you divide anything by 0, what's the answer? What's the answer? So value is equal to quality of, sorry? What's the answer?
It's a 0.
0? Is it 0? Is it 0? If you divide anything by 0, is the answer 0 or undefinable?
It's undefinable.
It's undefinable. Good. You remember maths in school? Anything divided by 0 is undefinable. So the reason that public sector patients cannot place a value on their care is because the cost is 0. So whenever somebody does not contribute or pay for, or the perception is created that they're paying for something, they have great difficulty in assessing the value of something. And that is why you're going to get skewed results like this 80%. Now, if you take a patient in the public sector, somebody that scored, let's say 80%, meaning they said they're very satisfied. They're very satisfied. Okay? So they did that after not paying anything. So there's no price sensitivity, no cost sensitivity. And to them, well, it doesn't cost me anything, so I'm pretty satisfied with it. But if you actually bill the patient for that service, let's say that patient came in for an outpatient visit. Now the average cost of an outpatient visit is 400 Rand. If you gave the patient the bill for 400 Rand for that service and then give them the survey after that, how do you think they would have scored that? Do you think it would have been 80%? Do you think that the satisfaction scores would be just as high?
No, I don't think so, because they'll measure it in terms of rands as well.
Yeah, exactly. So they've now, the equation is now changed. So the quality over the cost is not 0 anymore. The cost is 400. Okay, so now they have a perception of the value. They're saying, well, for 400 Rand, I expected more. Okay? So this is also one of the big issues in the public sector when they do these satisfaction surveys, is people don't have a sense that their perception of value is undefinable because their cost is 0. Now, it's exactly the same thing for you in DSD. If you go and do a satisfaction survey, I wouldn't be surprised at all if you get pretty high satisfaction scores, because the same applies. The cost to the client is 0. So the quality is undefinable. The value of that interaction is undefinable, because when you divide anything by 0, it's undefinable. Okay? On the other hand, and this is the main reason that we pivoted to experience, because experience is not asking you, are you satisfied or not. So just bear that in mind. That's the kind of mathematical explanation for why satisfaction is not a good measure. Okay, so we were on this issue about do clients and customers expect the same thing, and it was a fabulous answer to that. It is, the reality is they don't have those same experiences in the public sector as they do in the private sector, but they really want the same thing. When they come to you, they expect the same service that they would get at a 5-star hotel or a world-class restaurant. So bear that in mind. This always has to become the central issue of how do we actually enhance our clients' experience. And go back, remember, clients value the experience far higher than they value the actual intervention. Okay? Next slide, Vic. I got this slide up, but these are just examples of where you would get really good services. I mean, Starbucks, is world-renowned. People flock to go there. But essentially what they're selling you a cup of coffee. Okay? But what they have mastered is the service around that cup of coffee. Okay? People go to Starbucks for the experience more than they go for the coffee. Because coffee is coffee is coffee. Irrespective of where, but they pay a premium price at Starbucks. Why? Because they want that experience. Okay, Starbucks, the experience of going in, the smell of coffee, this perception that we're selling you world-class coffee that you can only get at Starbucks is all pervasive in the store. Okay, and what clients are doing, they're prepared to pay a premium for that. Now, Starbucks coffee, I'm not sure what it costs in South Africa, but it can't be cheap. But that coffee is no different to the coffee you can buy and Pick and Pay and make at home. What's differentiating is the experience that you get at Starbucks. Okay? And it's the same with a lot of these other examples. They may not be familiar to you. The Ritz-Carlton might be. And what happens is once they are able to optimize that experience, they can actually charge clients far more, and people are prepared to pay for it. This is the value of experience. Okay, next. Okay, this is the key question. Is the experience in your organization something that you are proud of? I mean, what do you think? Let's just take some answers. I mean, this is a class, you know, we can have a discussion and debate about this. This is no indictment on you or your organization. What do you think, you know, is this kind of client experience something that you're proud of in your organization? Or what do you think amongst DSD? Is this something you talk about as a department, provincially, or within the organization? What's the overall consensus? Anybody? What's the overall consensus about the client experience in your organization, in your region, in your province? What's your perception? Anybody?
Prof, I think we don't want to talk because
Yeah.
I don't think it's very positive. Listening to the feedback, looking at social media platforms, etc., and the feedback that clients give there, not only for social development, but I think government in
General.
as a whole.
Yeah. Yeah.
In general, it's not very positive.
Yeah. I agree with you. I agree with you. But I think, you know, we need robust discussion and debate about this because we need to change it. You know, it's if you go leave this classroom and don't try and implement some of these things, it's pointless. And we need somebody to take the lead, maybe in this group or a group of you guys to take the lead, and I'm prepared to work with you on this. Let's go and get the data to prove that the experience is subpar, is not what it should be. Okay? So you understand, you know, why is experience important? You kind of have a sense of it now. We still cover more of this. What is the actual levels of client experience in South Africa? And based on this, you know, make proposals in terms of how to optimize it. Otherwise, it just, you know, if somebody doesn't take the bull by the horn, the situation perpetuates itself. I mean, everybody just sits back and says, oh yeah, the service is crappy. I know that. I mean, you know, the idea here in this program is to develop transformative leaders who understand the process. So already in a few minutes, you know, why is experience important? You know that clients value experience far higher than they value the actual intervention. You know that we can measure experience. And you know that, as you will learn throughout, you know, as we move on, that we can implement tangible strategies to actually improve that. I mean, it would be fantastic if, you know, if the public sector starts getting positive feedback about the way they conduct themselves. Now, you are the public sector, by the way. You know, so it's incumbent on you to implement these changes. And, you know, you can't change the whole public sector, but you can change your unit, change your organization, you can change your region, change the way your province does things. You know, you are the public sector. So when we say that the comments are overwhelmingly negative, they're negative about you. And I say the same thing to my colleagues in healthcare. You are healthcare. So people are complaining about healthcare, they're complaining about you. Okay, so you guys will now have some information, some approaches in which to make these changes. And I think, you know, and I can support that, you know, by speaking to people at ministerial level and above. In fact, incidentally, I actually met your deputy minister this weekend as well. She's one hell of a character, okay? And really invested and interested in what we're doing. And I know that she will support an initiative like this, targeting optimizing client experience within the next years. I'm not sure what her term is. I know for a fact she'll support that. Okay, so I think the answer is pretty obvious, but it's probably too hot a potato to touch at the moment. Okay, let's go. Next slide, please. Okay, so next slide. I think I spoke to you about this in session 1 when I spoke to you about, you remember I put up the graph and I said, well, what is the purpose of leadership? And what is the purpose of leadership, by the way, in 1 word or 2 words?
Value creation.
Ah, great, excellent, wow. Okay, it's value creation. So all good leaders, I said, walk in the morning, their question is, how am I going to create value today? And it just could be simple, by making one client feel that they have had a positive engagement or experience in my unit. That's value creation. Because the client walked in, they didn't feel that way. When they walked out, they felt much better. That's value creation. It didn't exist, and then it existed. Okay? And then what I said is, I clearly remember saying is, we also need to, from this group, I mean, you guys are going to be a smart group. I think it will be very sad if we don't actually start tackling these key issues. And I said, well, how would we kind of define value in the context of DSD? Because in healthcare, we have defined it, and we have defined it in terms of that. It's called STEEPS. We look at it's safe, timely, effective, equitable, efficient, patient or client-centered. And I asked you, well, you guys are the domain experts. What do our clients want from us? So, and I remember the answer overwhelmingly, well, it's pretty much the same. So I kept this slide up to remind you about that. This is healthcare. But I think we need to create our own domains of value in the social services, in DSD. Now we can work together. I know we have about 213 people in this group. Not all of them participate all the time, and I get that. But with 213 senior DSD leaders, we can do some kind of internal brainstorming, you know, to figure out what these equivalent would be in social development. And I think it's something that should be done, okay, so that we have our own perception of value as it pertains to social development. Now, the one thing that's missing here is the most important thing. Now, even healthcare, I have added a 7th component. What do you think that 7th component is? Or should be? What are we doing for time, Vic?
10, 3 past 10.
What do you think? Sorry? Repeat that?
I also think staff experience.
Yes, brilliant, brilliant. Staff experience. So what I do is I put staff, take the safe, put it right at the bottom, okay, and change the first S to staff experience. Now we're going to talk a lot about staff experience as well. So when we speak of client experience, don't get the perception that I'm talking about just clients on the demand side or customers. Remember, internal stakeholders are also our clients. If you have 10 reports, they are your clients. Okay, so staff experience should go to number 1. Timeliness, effectiveness, equitable, efficient, and client-centered. And then safe. Okay? So somebody should take some notes for the group that I think project 1 should be defining value in the context of DSD. 2 is executing on the patient on the client engagement part within DSD. Couple of questions, data collection. So actually running client experience to surveys, and we have surveys to help do that, but that is going to have to be done centrally from the department, because the platform is privately owned. Okay, so it's just unfortunately the way it is. But the good thing is, once the DSD signs up, every single office gets to roll that out. All the data is aggregated centrally, and we're able to give you the results with heat maps, etc., etc. So I think these are 2 really important things that are missing that we can do. As I said, if any of you have master's or doctoral ambitions, these are also really good topics for you to tackle. Okay? And if you have interest in that, please reach out to me directly by email so we can discuss some of that and how we can move forward. Okay, so...
Can we just pause for like 30 seconds?
Yeah, sure. So what we're going to do is we're going to take a short break. I'll give you a 10-minute break. We'll come back and we'll continue. Okay, so what's the time now?
It's now 21 minutes.
21 minutes past. You come back at 10:30 and we'll continue. Thank you. Muted, Vic.
Okay.
Done.
Yeah.